And hello there, it's noon. And thank you guys for reaching out to me in the week and telling me that you missed the Facebook Live last week. I had said the week before that last week on the 6th, I would be doing Grandparents' Day with my little babies, and so that's why we did not have a Facebook Live. But thank you for reaching out and telling me that you missed it, because I only do it for educational purposes, because I want you to be really, really smart and be smart about your body and those kind of things. By way of introduction, for the new people that may not know me, I am Dr. Heil-Mealey with Abundant Health and Wellness. It is a holistic healthcare clinic located in downtown Humble at Main Street and Avenue C. Now, I'm thinking this is going to be the last installment of this series, which is Why Am I So Tired? So there's 16 reasons. We've talked about 10 of them in the last 3 sessions. So I'm hoping we'll get to all 4 of them, but I may be long-winded and we may not. So we'll just see. So the 16 causes of why am I so tired, we talked about this. If you want to know more about this specific topic, you can go back and look at the other videos there. They're all on our YouTube channel, so we keep it up there so you guys can refer back. So adrenal fatigue, B12 deficiency, candida, that's a yeast infection or a fungal infection, depression, okay, fibromyalgia, food hypersensitivities, insufficient sleep, iron deficiency, lack of exercise, and low thyroid. We talked about all of that in the previous 3 sessions. So if that's something that is important to you, you want to go back and look at that, and they're labeled part 1, 2, and 3. So you can see in the list, wherever I said it was in the list, it'll be the 1st, 2nd, or 3rd, so you'll figure that out. This is a great resource. Now, this is a book by Dr. David Brownstein. It says, the title is Iodine, Why You Need It, Why You Can't Live Without It. This is really, really good for you if you are dealing with hypothyroidism. So he is a board certified MD, but he treats hypothyroidism. He's pretty holistic. And this is a great book. It's written in very common language. The print's not too little. You don't have to have a master's degree in science to be able to read it. Very, very good. One of the biggest takeaways that I received is that most people are iodine deficient, and the conventional wisdom on how much iodine to use is far, far below what you need. So if you need some specific information on this, you can get this book. I ordered mine, I don't know, it was a used one, but I'm the only one that's written in it. So, and it's pretty pristine, you can see that. So if you have thyroid issues, you might want to consider this. If you have fibroids, fibroid breasts, fibroids in the uterus, you might want to get this, because high levels of iodine will absolutely shrink those fibroids, and that is so much better than having to go and have them cut out. So I'm going to just leave this with you here on the thyroid. Now, number 11, the 11th cause of why am I so tired is menopause. Now, I think that's just a dirty word. It's bigger than 4 letters, but oh my goodness, menopause just sucks. I'm just going to say it. It says if you're going through menopause, feeling tired some or most of the time is likely nothing new. 61% of postmenopausal women experience symptoms of insomnia, and as many as 92% say that they are generally tired. So tiredness during menopause is associated with the hormone changes that play havoc with your body. Night sweats, hot flashes, pain, anxiety, depression are typical symptoms. General lack of energy, sleepiness during the day, desire for naps, difficulty focusing on your regular routine, and mood swings and irritability. Nobody's got time for that. So I went to a conference. This is a transformations conference that I went to, and I had no idea that these other symptoms were associated with menopause as well. So I'm going to read this list. It's 40, right? 40 different symptoms. So ladies of a certain age, you might not have recognize that these symptoms may have to do with menopause, and if you are menopausal, there are some things that you need to know. So before I get into the list, just because I'm going to not remember if I don't tell you, 95% of cardiovascular events occur in women who are postmenopausal. Natural estrogen, bioidentical estrogen, is very cardioprotective. Synthetic estrogen, which is what your normal hormone replacement therapy, synthetic estrogen is not good for your heart, okay? So bioidentical estrogen is cardioprotective, but the synthetic estrogen will hurt your heart. So I want you, if you are considering hormone replacement therapy, then I want you to make sure that you're getting bioidentical estrogen. Now, what does that mean? Well, that means a lot of different things to a lot of different people. I've got some things on my desk. This is a formula. It's called MPEP. These letters, they just mean whatever they mean. This is a great adaptogenic herbal blend. And so this was made for menopausal women. We have women of all ages on it because it just balances your hormones. It's awesome. It's very good. It's plant-based material. Wild yam, Don Quai, chase tree berry, sal palmetto, black cohosh, hops, and ginkgo. So those are all the things that are in there. Here's another formula we have. It's called Warme, and this is made by, who makes it? I don't know. It's 100% organic, and that's what I like about it. And this is your Ayurvedic medicine. So this is India with a dot, not a feather, okay? In a study of 100 plus menopausal women, they found that Warme significantly benefited their hot flashes, their night sweats, hormone balance, their cardiovascular response, their mood, their bone health, and their quality of life. In that same study of 100 plus women, they found that this product significantly benefited arousal, vaginal dryness, sexual satisfaction, and intercourse discomfort. So these are some of the things that nobody likes to talk about, but this is some things that happen when you are menopausal. We don't want those things. So this is our Ayurvedic formula that works. This is an enzyme formula that works. It has your enzymes in it. It also has almost the same herbal formula as in the MPEP. It is a capsule instead of a liquid, and the dosage is 1 capsule per day. Very clean, very organic. So these are some things that we have on hand if this is something that pertains to you. I'm just going to tell you, if you're not having any of those symptoms we just talked about, you're probably going to sleep well, and if you sleep well, then you're not going to be tired, and that's what this is all about. So let me just tell you some of these menopausal symptoms that you may not know. Hot flashes, cold flashes, night sweats, clammy feeling, heart palpitations, irritability, mood swings, trouble sleeping, irregular periods, low sex drive, vaginal dryness, fatigue, anxiety, depression, lack of focus, poor concentration, faulty memory, incontinence. Nobody needs that. All right? Itchy, crawly skin, achy joints and muscles, tense muscles, sore breasts, headaches, digestive issues, bloating, allergies that worsen, weight gain, hair thinning or hair loss, more facial hair, and that's just because the estrogen goes down, the testosterone goes up, and you just get all that nastiness there, okay? Dizziness and vertigo. Now, I would never have thought dizziness and vertigo would have been a menopausal symptom. It just is. Changed body odor. Okay, so you can think that you smell the same as you always smell, but you may smell differently at menopause. Electric shock feelings, tingling in the extremities, bleeding gums, burning tongue, or the burning roof of your mouth, right? Chronic bad breath, osteoporosis, weakened fingernails, or ringing in the ears. So of these 40 symptoms, you know what? I had maybe 2 of these several years ago when I stopped having my monthly cycle. I think personally, when you do a liver cleanse, you get rid of all the hot flashes and the cold flashes and all that kind of stuff. So I think really that part of these symptoms bleed off into other areas. So if your liver's not right, from your liver has cholesterol. That's where all your hormones are conjugated. So if your liver's sluggish and congested, then you're not going to be able to use that things that you want to think about. When we do liver cleanses, which we do a lot of, we find that hot flashes just go away. So I was going to tell you, I only had a couple of these, and I had a real emotional trauma a few years back with my mom. She was diagnosed with cancer. She went through chemo and radiation, and it almost killed her. And it was very, very traumatic for me. And I will just tell you, within days of these 40 symptoms, I had 10 that I had never, ever had before. And so you might think you've gone through menopause pretty easily, and then you could get an emotional trauma or shock or scarring things, which is just, nobody wants that. So if menopause is an issue with you, then we can work with it holistically. We have here in the clinic, we've got the saliva test and see where you are. We also have blood spot testing that you can do here in the clinic. We send it off, and you don't have to go to the doctor or anything. It comes back with a lab report, and we can tell you, yes, you are, no, you're not, this is what you need to do, whatever. If you are very these might not work for you, but we've got a doctor that we work with who does do bioidentical hormones. And so we've got really the full gamut of things that you can do if this applies to you. So don't suffer in silence. Don't be tired because your hormones aren't right or your liver is congested. If you need help, then we're able to help you with that. We want to help you with that, but you're going to have to reach out so we know that you are. You don't want to just be walking around itchy, tired, scratchy, and dry, right? And be irritable and be tired, and that's just, nobody has time to do any of that. And we've got remedies for that, which I showed you quite a few of. Postpartum. Now, I'm way too old for this, but this happens. One of the most common complaints new moms have is feeling exhausted, along with going through the ordeal of childbirth and recovering from a C-section, if that pertains to you, right? New moms have a new set of infant-related activities to keep them up around the clock. So we know that. So we want to, if you are someone that has just had a baby and is having this tiredness, it could just be the season that you're in, and you need to sleep when the baby sleeps, and hopefully you'll move out of this. So if you have tiredness that lasts for months and months and months, then you want to see some kind of a practitioner and get some help on that. Babies should be sleeping through the night by about the 3rd or 4th month. So if you nap when the baby naps, you're going to be able to keep up with the baby, and you're not going to be so tired. But after the baby starts sleeping through the night, if you're still having issues, then you need to see a practitioner and see what we can do about that. 13, seasonal depression. Now, this is called SAD, okay, seasonal affective disorder, I think is what it's called. Yes. It's known as seasonal depression. It is a type of depression that is related to the seasons. Most people experience seasonal affective depression when they have the symptoms that begin in the autumn and last through the winter. So they say that this happens because of the lack of sunshine. So wherever you are in the world, your sunshine may be more, it may be less. But if you are affected with this, there are some things that you can do. Symptoms associated with seasonal affective disorder are low energy or tiredness, irritability, hypersensitivity to being rejected. Well, nobody has time for that, right? Excessive sleeping, difficulty getting along with other people, heaviness in your arms or your legs, craving carb-rich food, which are our comfort foods, right? And then weight gain. So all of those are symptoms of seasonal affective disorder. It is a real thing, mostly in holistic world, okay? In holistic world, we believe it is a lack of vitamin D because you're not getting as much sunshine. We have sunshine in the bottle. This is something that is absolutely fabulous. It is a liposome spray. So you just spray it right into your cheek or under your tongue. It doesn't taste bad. Every spray is 1,000 international units, and there's no waste to it because whatever you get in your mouth is going to be absolutely absorbed into the bloodstream where you can use it. Now, if you have your blood work and your blood work says that you have a vitamin D deficiency, your doctor may have given you a prescription for 50,000 IUs that you take once a week. That's a lot. Now, why is that a lot? Well, I'm going to tell you. Number one, it is a synthetic variety. Number two, you take it orally. It goes through digestion. It gets chewed up in the liver, right? It gets chewed up in digestion in the stomach and then in the liver. And then from the liver, it passes into the kidneys where it is taken up in the bloodstream. I have a whole video chat about vitamin D deficiency, and so you might want to scroll through the YouTube and find that. It might be beneficial for you. Ours, on the other hand, is a liposomal spray. That means you get absolutely everything you need in just a few pumps. Now, I will tell you that we have looked at this clinically. We have people that come in with their blood work, and their blood work is showing that they are low in their vitamin D, and we give them this product. They take it for 2 months, and almost every time their vitamin D level has doubled in 60 days. So that means this product is very, very effective. It's very easy to use. The thing I like about it, and if you watch me on YouTube, you'll see that I talk about this a lot. It has the cofactors in it. It's not just vitamin D. It's got your cofactors. So what does it have? It has your K2 in it as well. If you don't have K2 in your vitamin D, you're not going to be able to absorb the vitamin D because it's not bioavailable. So this is the vitamin D that I use. On your blood work, it's going to tell you that normal range is anywhere from 30 to 100 nanograms per deciliter. In holistic world, we don't want you to be under 60, right? So if you look at your blood work and your blood work says you're under 30, then you're very, very deficient. If it says you're between 30 and 50, I still think you're deficient. So you want to be able to work with that. Now, why is vitamin D so important? Well, vitamin D is a little, some people call it a hormone. Some people call it a vitamin. And so you just kind of have to pick whatever. I mean, it does a lot of things. But one thing that we have noticed is that if your vitamin D level is above 60, it's very rare to have the flu, it's very rare to have depression, and it's very rare to have cancer. So for those 3 reasons, as we're going into the flu season, it's really, really important to make sure that your vitamin D level is where it needs to be. Now, a lot of your MDs say that they don't want to check your vitamin D level because it's a wasted test. When you go to the doctor, you're going to have to ask specifically for vitamin D. They're not going to recommend it. They don't think that it has any validity in most cases. So you want to make sure that you ask for that. It is an add-on cost. It could be anywhere from $40 to $80 depending on the lab and kind of what they're doing at the time. But it's very, very important. If I know as a woman that if my vitamin D levels are high, I'm not going to get cancer and I'm not going to get the flu and I'm not going to be depressed, right? Because nobody has time for depression, then vitamin D is a real easy way for me to do that. It's, like I say, there's no waste to it. It doesn't taste bad. In this little bottle, there are 375 pumps. That's a lot. I do 9 pumps a day because a healthy person, and I'm a healthy person needs 9,000 IUs, international units, in order to maintain their vitamin D level wherever it is. So if you're very, very low, you're going to want to double that. I'll just make a confession to you. A few years back, And I used to go out in the sun all the time. As a young person, as a young adult, I was out in the sun quite a bit. And then I learned that that was not necessarily such a good thing for the wrinkles and whatnot. And so I didn't really think about it because I tan up really nicely. So I think I absorb all the vitamin D that I need. And I go out regularly. But when I had my blood work done several years ago, my vitamin D, and I hate to even admit this to you, but my vitamin D was an 18, very much below the minimum of 30, and disgustingly low if the minimum is 60. And so I began taking this formula, and my levels rose rapidly, and they have stayed where they need to be. And my last blood work, which was last year, I was at 80%, or 80 nanograms per deciliter. So this is what we need to do, and I don't suffer from depression, and I certainly am not going to get the flu, and hopefully I'm not a candidate for cancer. I want that opportunity to just pass by. So those are some things that you can do to really help yourself. If tiredness is a seasonal affective disorder, it's probably because you don't have enough vitamin D, and we've got just the right vitamin D for you with no waste. The 14th thing that we're going to be looking at is stress. Oh my goodness. Who does not have stress? We all have stress. Some people wear stress as a badge of honor. Some people create stress wherever they go because they're just drama queens and that kind of thing. I don't want to be that person, and I don't want to associate with that person. I'm just going to throw that out there. Those of you that know me know that's how I feel. I don't like the drama. I don't need the drama. It wears me out. I don't have any time to waste on that, okay? So stress. Stress can take an enormous toll on your health, leaving you feeling physically exhausted and mentally drained. Left unchecked, stress can lead to heart disease, obesity, diabetes, and high blood pressure. So you want to know that when you are stressed, your adrenal glands pump out a lot of cortisol, right? If you are in that cortisol bath for a long time, what's going to happen is you're going to have adrenal fatigue. Now, a lot of medical doctors do not believe there's such a thing as adrenal fatigue, but I can just tell you, you can look at the pupil in your eye, and your pupil should be relatively small. Now, I have extraordinarily small pupils. The eye doctors told me that. I don't know why that is, but my pupils are very small. But we have people that come in all the time with very large pupils. And so if your pupils are large, now sometimes it means you've been smoking pot. That is something that's out there. I don't do that. Hopefully you don't do that because it's illegal in this country. If you're on antidepressants, your pupil is going to be very large. If you have adrenal fatigue, your pupils are going to be very large. And so if you can rule out marijuana, if you can rule out antidepressants, then your pupil is still large. You've got adrenal fatigue. A lot of times you'll have the purple bags under your eyes, that purple shading, looks like you've been hit in the eye. That also is a sign of adrenal fatigue. And so this is a real thing with stress. And there are things that we can do to rebuild the adrenals, although you need to know that it can take up to 10 years to recover from adrenal stress. So that's something that is very difficult to manage, and that might be why the medical profession says there's no such thing, because they can't get it to turn around. It will turn around, but it will turn around after decades, at least a decade, of hard work and treating yourself well and resting and taking the supplements to rebuild your adrenals and that kind of thing. So I'm just going to throw that out there. There is a difference between being physically tired at the end of the day because you have worked out at the gym or you have a physically demanding job and feeling exhausted because of mental stress. Mental exhaustion from stress can be caused by worrying about the situations in your life, such as financial worries, friendship problems, or job issues. Chronic stress becomes a way of life, and so does being tired all the time, even when you get an adequate amount of rest or sleep, okay? People that suffer from stress-related fatigue usually experience these symptoms: muscle ache or weakness, headaches, blurry vision, dizziness, short-term memory problems, trouble with concentration or making decisions, loss of appetite, feeling helpless or hopeless, lack of motivation, slowed reflexes, and irritability or moodiness. Again, people, nobody has time for irritability and moodiness. Life is too hard already. Things are too stressful already. And so if you are a person that stress has knocked down, and we all go through times with that. I mean, people go through financial reversals. People go through the loss of a loved one. People go through garbage in their life, and sometimes for long periods, and it can cause adrenal burnout. Don't suffer. We have help for you, okay? Now, the 15th, we are going to make it. We're going to make it through all of these today. The 15th reason for tiredness is a sugar hangover, all right? So, hangovers don't just occur after drinking alcohol. They also can occur after too much sugar consumption, okay? So, there is really no quantifiable data to know how much is too much, but this is the way a sugar hangover will affect you. Okay, it affects many organs in the body from your brain to your small intestine. Sugar also feeds candida, which suppresses your immune system. It raises your blood triglyceride levels and it disrupts your digestive processes, right? We don't want to have that. So generally, it says generally you're likely to experience a sugar hangover if you experience these symptoms following ingestion of sugar, even natural sugar, okay? Fatigue or feeling sleepy, foggy thinking, bloating and gas, constipation or diarrhea, either one of those, joint pain, headaches, allergy symptoms, mood swings, and skin problems. So if you are tired and you also have these other symptoms, you could be having sugar hangover. So what does that mean? That means you want to clean up your diet. Now, there is a mineral called chromium. You might know it as chromium picolinate. It will help you not crave sugars and starches. So that is a supplement that you can get. If this is a problem with you, if you have a real sweet tooth, or if you just love those carbs because they're the comfort food, then if you take a supplement that has a good quality chromium in it, it's going to dampen those cravings and you'll be able to move through your day without those sugar cravings. Okay, so that's just something to think about. Then the 16th reason that you are tired is that you have an undiagnosed disease, okay? And so we don't ever want to think about this, but when you do think about it, the body is trying really hard to get well. You've got some kind of a disease process. You don't even know that you have it. And so the body's using all of its energy to recover and no energy for living, and that's why you're tired all the time. So numerous underlying diseases or conditions associated with tiredness and fatigue. If you don't believe any of the aforementioned conditions are related to you being tired and exhausted, then you may have an underlying condition. Some of these conditions include, but are not limited to, asthma, cancer, chronic fatigue syndrome, chronic obstructive pulmonary disease, COPD, Cushing's disease. Now, Cushing's disease is when you have a tumor on your pituitary. Okay, your pituitary's up here in your head. Diabetes, the flu, heart disease, hepatitis, HIV, kidney disease, liver disease, lupus, mono, pneumonia, rheumatoid arthritis, urinary tract infections. So all of these are very common. We see these in our clinic all the time, but I will just tell you there's hope for you if you have one of these diseases. Don't just put your head in the sand and say, I don't want to be on medication the rest of my life. I'm not gonna go this way. You can do things holistically to get you out of these conditions and get your body to heal itself. So those are our 16 different reasons for being tired. Hopefully, you may have found your answer. If you have not found your answer, we can definitely test you to see kind of what you have. If you are in that big group of menopausal, postmenopausal women, we've got lots and lots of help for you. I didn't say this. I forgot. These are creams. They're holistic. It's all bioidentical. We've got your progesterone, your DHEA, and your estrogen. So these are all very bioavailable. So we have a lot of different things for you to look at, a lot of different things for you to try. And if you want to go see a doctor and have the injection of bioidentical hormones, we've got a good source for that too. So I'm going to say goodbye. Thanks for spending your lunch hour with me here at Abundant Health and Wellness, and I will see you next week with a new topic. Take care. Have a great weekend. Be good to yourself. Practice self-care and rest.